Hello, you are here to undergo surgery, which can cause feelings of stress and anxiety. Therefore, we will try to explain the sequence of events. Upon arrival, patients are requested to register at the reception desk. To register, you will be requested to provide identification, your referral letter, and health insurance details. You will be met by different staff members who will explain in detail your stay in the hospital and the surgery process. You will need to provide your consent to the operation and anesthesia. Please read the form carefully and ask any questions. We recommend that you leave your personal belongings with your family members or those accompanying you. If you arrive alone, you can deposit your belongings at the reception office, which is open 24 hours throughout the entire week. The requested preparation: wash with antiseptic soap available in the hospital showers. From midnight, you are requested not to eat or drink. This is to reduce the chance of complications after surgery. You are requested not to smoke for 24 hours before surgery. Please cut your nails short and remove all nail polish. It is important to sleep well before surgery. If you are reliant on sleeping pills, please inform the anesthesiologist. It is possible that the anesthesiologist will decide to give you relaxant on the evening prior or the morning of surgery. On the day of surgery, you will need to wash again, following the directions from the staff, and wear a gown without any other clothing underneath. For women that are menstruating, please inform the staff. When your turn for surgery comes, you must be without any accessories, such as a mouth plate, dentures, contact lenses, jewelry, etc. When you are in your bed, you will meet part of the surgical team. A nurse will ask you a few questions before taking you to the operating room. Your escort will be asked to wait in the waiting room. In the operating room, you will receive an anesthetic that will induce sleep so you don't feel pain or remember the surgery. At the end of the surgery, you will be moved to the recovery room. When you wake up, you may be connected to tubes like a drain, a feeding tube, a catheter, intravenous tube for fluid or oxygen, which were inserted during surgery. The necessity of tubes is dependent on the type of surgery and the procedure. More information regarding tubes will be provided by the staff. The type of surgery and the necessary readjustment post-surgery will be determined how long you will need to stay in the recovery room and when you will be able to return to the general ward, where you will begin the recovery process. You will have a bell by your side to call a staff member if needed. To avoid complications after surgery, it is important to do the following 4 actives. The first, reduce pain, to reduce your suffering and allow optimum recovery for the surgical wound. Report every pain to the nursing staff. Second, breathing exercise, with the help of a physical therapist or on your own. Third, early movement and permission and support of a staff member is necessary for the first time you get up in order to reduce the risk of falling. Fourth, sit upright. Avoid long periods of laying down. Return quickly to move your body. It is the key to avoiding complications and fast recovery after surgery. You can return to eating and drinking according to instructions from the staff. According to your medical status, the doctors will inform you regarding your stay in the hospital and when you can be released. At the time of release, you will receive instructions regarding continuous care and when you need to have a checkup. If you have further questions, the hospital staff will be happy to help. Wishing you a fast recovery, the hospital staff.